to help us maybe get a more hands-on and a better understanding of the impact that breast cancer and why we need to raise awareness. We are joined by Francisca Tsikai. She's a palliative care nurse consultant. Francisca, good morning and welcome to Morning Rush. I feel bad because you've got the pink ribbon. But we are very aware that
I'm very close to that color. Look at my pocket square here. So we are very much in solidarity.
Okay. Are you sure?
Yes.
But it is October, obviously. Every year it's become a staple on the calendar in terms of Breast Cancer Awareness Month. Maybe let's start there, maybe in terms of trying to give people a general understanding of what breast cancer is.
Okay. Maybe I can start by explaining what cancer is.
Okay.
Right.
Cancer is caused by the abnormal growth of cells. If cells do not, cells should grow the same. Cells of different organs should grow the same. They should look alike. So for some unknown reason, you may find that those cells, they just develop the way they want. And by developing the way they want, it causes growths. And we have two different types of growths that can develop, either benign growth or malignant growth. Benign growth, it means that it's not cancerous. It's just a growth, and when it is dealt with, well, let's say it has been removed, then it's okay. Then the patient will not have any problems. But malignant growth, that is cancer. So cancer can develop anywhere in the body, and cancer has no age. It can develop on a child, young child, and it can develop anywhere, any part of the body. But today, because it's in October, because it's Breast Cancer Awareness Month, we're going to talk specifically about cancer of the breast. So for cancer of the breast, it develops on the breast or in the armpits.
Oh, in the armpits?
Sometimes it can start from this side. One can feel a lump. Yes. In fact, I have also started by saying it's a lump, and our bodies are closed books. You cannot see whether I have a lump or not. Therefore, one is to be examined and one is to go for scans. But one most common cancer that can be felt a lump is breast, only breast. Okay. Otherwise, I can develop a lump in my tummy, you don't know. You can also only see signs and symptoms. But a breast, if one is cancer in the breast, they can feel a lump. That is the first time. So cancer of the breast is one of the most common cancers among women in Zimbabwe, even globally. And as I've said, what causes the growth of the cancer, what causes the cancer. So it is very, very important for us to share information with the people in the communities. And for me, I would also like to make sure that we also have some of these sessions in Shona, so that people who are, some of us, some
so
of the people...
better understanding.
Yes. So, but my presentation is going to be in English. So, predisposing factors that cause cancer of the breast. Or you refer to them or to risk factors.
Okay, yes.
Or predisposing factors. One, age, especially around 40 and above. Secondly, I wouldn't like to say gender as such, because there is also cancer of the... some men can also develop cancer of the breast.
Breast cancer?
Yeah.
Right. Yesterday we also had a guest who spoke a little bit on that. May you shed light on that a bit, because I think we've heard much about breast cancer among women, but not so much perhaps among men. What could be some of the signs as well as symptoms for cancer among men?
Okay, they are almost the same. Only the difference is that for a man, they don't have big breasts, like the breasts that ladies have. But for among men, you can find that the nipple, men also have nipples, isn't it?
Yes.
It may be inverted, it may be looking up.
Oh, okay.
You know, the change in the nipple. Yeah. So everybody should know how their nipples look like.
Okay.
Yeah. And also, sometimes a male can also feel pain around that area, or some lump. And let me hasten to say that sometimes men can develop breasts. I'm sure you've seen men with the breasts.
Yeah.
And this may be due maybe to steroids that they are using or some of the side effects of antiretrovirals.
Okay.
Yes, but in cancer of if a man has cancer, the breast don't grow big like in gynecomastia. It's just that breast that is affected will have inverted nipples, and it also if the person examines it, they'll feel a lump.
And
pain.
Speaking about examining, maybe I want to get into you on that. Early detection seems to be a main thrust whenever
Yes.
over the years, whenever we've discussed any form of cancer. But obviously, because we are focusing on breast cancer being October, how important primarily is early detection, and how early can you detect it? Because I mean, if you're feeling the lump, does it mean it's already developed too much? What are some of the ways that you can get tested so that you don't have to wait until you can feel the lump or your nipples are inverted.
Inverted.
Yeah.
As we said that you cannot tell, so it has to be detected early. That's why we are talking about cancer prevention, by talking about diet, by talking about how one can behave. So cancer of the breast is not prevented. It can be detected early.
So you can't stop it, you can only nip it in the bud, literally.
Yeah. So because of some of the risk factors that I'm talking about, if one is from a family where there's breast cancer, it means that they are likely to develop breast cancer. And also smoking and the type of diet that one is eating, and also obesity, stulra. Obesity, and the other predisposing factor is if somebody is on hormone replacement therapy. Hormone replacement therapy, some ladies when they reach menopause, they may be commenced on hormone replacement therapy, which will make them feel good, but it can also predispose to formation of breast cancer. And early menarche, if young girls have their periods early, we refer to that as menarche, maybe 10 years of age. And also when older ladies stop menstruating, that is menopause. When ladies reach menopause, maybe after 55 years of age. And not having a child at all can also predispose to cancer. Or having a child very late in life.
So those are all risk factors.
Yes.
You did speak about how you would love for us to have these discussions in vernacular,
Yes.
so as to increase understanding. And I want to touch on something related to that, because with these campaigns, even with the pink ribbons, we see it in my town, we see it in the urban areas. What work would you like to see being done to take it outside of the cities? Because I'm pretty sure it just doesn't affect my towns
Yes.
or the urban areas. What is the awareness reaching? In
Chendambuya, in Uzumba Maramba Fungwe, what's the strategy?
The strategy would be for health professionals at the clinics and at the hospitals to give health education, to talk about cancers of the breast. And we have health promotions officers in Zimbabwe, and it's part of their role. They know about the fact that this is breast cancer month, and they talk about it when people attend the meetings, that is. But for those who don't attend the meetings, they may lose out. And the other thing that I also want to talk about is the fact that sometimes people feel a lump in their breast, or they can see breast changes. They go and consult. Sometimes they are misdiagnosed. You remember I told you about 2 types of growths. Sometimes they are reassured that this doesn't matter. It's just a fibrous tissue, or it's not cancerous, which is very, very dangerous. For me, I feel that if a person has felt a breast lump, they should be examined thoroughly. What do I mean by examined thoroughly? Somebody has felt a breast lump, they can go for an X-ray of the breast. Yes. Mammography. It's called mammography. And usually in Zim it's done at the Well Women clinics.
Okay.
And it's a procedure which is prescribed by the doctor.
Okay.
The doctor is the one who has to refer
Who
a
gives you
patient. Yes.
All right. And then obviously, looking at this, you highlighted obviously the need for X-rays. Sometimes people getting misdiagnosed.
Yes.
We've seen, you walk around town, you go different places, you hear people selling different herbs and saying, it can treat cancer and or it can even prevent cancer.
Yeah.
How much information do we have about these herbs? And should people really be going and saying, all right, and
Yeah,
cancer?
and in addition to that, we've also been seeing the influx of Asian medicines and Asian, multi-level marketed sort of products that are also being proffered onto the market, different kinds of scans and, different forms of medication, if you may speak to that.
Yes. One thing about caring for patients is the fact that everybody has a right to choose what they want to do. So we refer to that as autonomy. And then it means that it is very important for people who use conventional medicine to do those breast cancer awareness campaigns so that they give them information. Remembering that those medications that you're talking about, they also want to market. And they can also go to the same people and give them information. It's now up to the patient to decide what they want. Just like I can give an example that maybe, we haven't spoken about management of cancer because we refer to it as multi-modality. We don't use one model. Depending on cancer is 4 stages. All the cancers are 4 stages. If it's detected early, the patient can be cured. Maybe they have removal of the organ of the breast. And then I'm talking about autonomy. A patient can say, I don't want. I want to go to so-and-so, either traditional healers, faith healers, and those modern day Chinese medications. So our roles as health professionals is to make sure that we give information.
They're educated. And speaking about giving information, I want you to look into the camera.
Yes.
Zimbabwe.
Very good. I like that.
Nechishona mowapa mashoko enyu erukurudziro panyaya yegomarara kuti how seriously should we take this in terms of maybe kuzowana information vanokwanisa kuiwana kupi
zvakanaka saka ini zvandinokurudzira ndezvekuti mukadzi wese kana munhu wese ngaazive zamu rake kuti rakamira sei nokuti kensa yezamu ndo yechipiri kumacancers evanhukadzi vatema munyika ino yeZimbabwe. Saka chinokurudzirwa ndechekuti munhu wese ngaadzidze kuzemena zamu rake. Of course, dzimwe nguva tinomboona vamwe varwere vanoti ndakaudzwa nemurume wangu kuti zamu rangu mune bundu, chaunotanga kunzwa ibundu. Asi mubvunzo wangu unenge wauya kuti varume vangani vanobata mazamu. Saka it is very important kuti munhu wese adzidze zemena zamu rake ega. Kuzemena kwacho munhu ngaazive kuti nyatso yake yakamira sei. Ngaagaruziva izvozvo, ngaazive kuti zamu rake rakamira sei. And uyezve ngaapoti achiona kuti mwambavhu amera mwambavhu here kana kuti ruoko rwake ruri kusaidi kwenge kwakazvimba kune bundu runenge rwakazvimba. Saka munhu kana achinge aziva izvozvo ndinofunga I think the most important thing is kurudzira kuti munhu ngaazive zviratidzo. Zvimwe zvezviratidzo zvekuti munhu angangodaro aine kensa yezamu. Remembering kuti tataura kuti bundu rinenge riri muzamu rinogona kunge riri bunduwo zvaro ratataura riye pachirungu tichiti benign kana kuti rinogona kunge riri bundu rekensa. Saka zviratidzo ndezvekuti nyatso yemunhu inogona kunge yakatarisa mudenga kana kuti inogona kunge yakuburitsa zviri kubuda muzamu imomo. Pamwe ukasvina so munogona kubuda kana mvura yechena kana kuti zvimwe zvichena kana kuti ropa. Izvozvo hazvina kunaka kunge zvichiitika. Saka munhukadzi kana aona izvozvo zvaitika ngaamhanye kunoona chiremba, ngaamhanye kuenda kuclinic 1. Zvakare anofanira kudzidzira kuzemena zamu rake. Handimbotoona ndiri kuona rangu zvinoenderana nekuti munhu ane zera ripi. Vaya vachiri kuenda kumaperiods, vachiri kuenda kunguva vanofanira kuzemena zamu ravo vapedza maperiods, because during period or towards period anenge akazvimba, anenge achirwadza. Saka kuzemena zamu munhu anenge akaribata akadai so anotanga amira pagirazi. Unofanira kutanga wamira unozemena wakatarisa pagirazi, unogona kusimudza maoko ako mudenga kudai wakatarisa pagirazi. Paunoisa maoko ako pasi unoona kuti mazamu ako aya ari kudonha sei. Akadonha 1 zvinoreva kuti pane dambudziko, anofanira kudonha pamwe chete. And then pakuzoenda pazamu panataura kuti unosvina zamu rako ukaona paine zviri kubuda, it's another problem. Bata zamu iri kudai uchidai, unenge wakaridivhaidha into 4 uchidai, ukanzwa mune chibundu chakaomarara, imwe red flag futi iyoyo. Kana kuti uzoenderera ukuona ukuku unenge une mwambabvu, kana kuti uona unge ruoko ruri kuzvimba. Chimwe chiratidzo zamu rinenge rakuita kunge orange pili, handimboona zvine orange timba zvakaita orange, rinenge rakuratidzika kunge rine orange. Dzimwe nguva munhu anenge achirwadziwa, zvinoti akarwadziwa pamanogona kutora zvekunyaradza kurwadza zvoenda zvodzoka futi, zvinogona kunge aine kensa yezamu. Ini chandoda kukurudzira madzimai nevarume ndechekuti kana munhu achinge aona zviratidzo izvi, dzimwe nguva unoenda kune munhu anokuita reassurance, anokutaura kuti hazvina basa neeji yako iyi ungaite kensa yezamu here. Izvozvo kana hazvina kunaka, enda unotsvaga kwechipiri kwaunoonekwa. Second opinion is very important.
All right, that was Francisca Tsikai, palliative care nurse, giving us a detailed awareness actually in terms of how to observe it. I think it's talking for to scan by YouTube.
Yeah, certainly it will be.
One also tsana guru vachizwa muri
vachizwisisa zvemandoro kwati kuti zvakamira sei.
Tinokutenda ini utandira nesimangwanani ano. A big thank you. Remember, October is Breast Cancer Awareness Month, and we will make deliberate efforts to make sure that you are informed. And I think, like Francisca was saying, early detection is key. If you're feeling something funny, even if you get dismissed, just make sure you get a second opinion, because it was very, very important that it is treated early.